I'm turning this over to Dr. Fawcett.
Thank you, Scott. This is a great introduction, and yeah, it was well received, so I was really happy about that. Yeah, so hi everybody. This is our weekly addiction Q&A webinar. I always start out, as Scott mentioned, with a couple minutes of talking about a topic, and I wanted to talk about one we've touched on before, but I want to return to it tonight because it keeps coming up lately in some of the skill stuff we're talking about with clients, and that is dialectical behavioral therapy, DBT, which is a mouthful, as you can see, because I couldn't quite say it on the first time around. So DBT is a really useful set of skills, really, and I want to talk a little bit about the history and then the four main groups that it does, group of skills that it really helps. But it was developed by a woman named Marsha Linehan in the 80s, and she developed it to work specifically with borderline personality disorder, which could be a hard diagnosis to work with. And she found that these particular focused areas, focusing on skills, were really useful to help people, help borderline individuals really start to make progress in their therapy. What we've discovered since is that these same sets of skills are very useful for other kinds of things as well, like ADHD, binge eating disorder, bipolar disorder, bulimia, anxiety, depression, PTSD, and especially addiction. And that's why I really wanted to mention it tonight, because I think we often talk about kind of ideas that are abstract and not particularly useful for people without a therapist sitting there to guide them. But these are really very useful skills that with some practice can be very beneficial for people. They're established in four different areas. And so I want to just run through them real quickly. The first is mindfulness, core mindfulness. And these are mindfulness skills, and these are, I think, generally recognized to be probably the most important of the four sets of skills. Mindfulness, we're increasingly discover, is incredibly important, not only for our focus, our regulation of our moods, but also training our brains how to really be aware of things. It's great for addicts in terms of being aware of body sensations and relapse triggers in terms of looking at patterns and so on. But mindfulness is really just that skill that is so easy to say, but it's really hard to do, of just staying in the present without being distracted, really noticing what's going on, and most important, in a non-judgmental way. I think if we all kind of get quiet for a minute and think about ourselves or some aspect of something, there's often a real critical slant to it. People are really highly self-critical. That judge, that critical voice in our ear that kind of undermines us and challenges us and tells us we can't quite do something or we'll never succeed or whatever it is. And so I think mindfulness is really a practice-based skill where we kind of sit and practice being in the moment and noticing what's going on and not judging it. That's the most critical key. So we notice our thoughts, our feelings, our sensations, our impulses. It's just a brief moment of awareness. And ideally, I think if I could live through my waking hours being mindful at all times, that would be a huge achievement. I think most human beings can only do it for a limited period of time before things kick in. But basically, we're looking at what's outside of us in terms of what using our senses, smell, hear, see, touch, and also what's going on inside. What are the feelings? What are you noticing? Is my stomach rumbling? Is my throat sore? Are my eyes tired? Whatever's going on, without judging it. But this really helps us slow down and notice things. And that just is something I think that addicts and probably everybody in general, frankly, is just moving too fast, jumping through things and really covering a lot of ground. And this really helps us. Incredibly powerful to focus. The second one, equally important, I think, for addicts, and especially in what I call intensity addicts, sex addicts, porn addicts, chemsex addicts, people who like to be busy, like to have that stimulation, like the intensity, and who have a hard time slowing down, dealing with boredom, dealing with open space, dealing with quiet time. That skill is what we call distress tolerance. And that's really learning how to, in short, it's learning how to accept ourselves and the present situations we're in. So we learn how to tolerate crises, we learn how to tolerate boredom, we learn how to tolerate whatever mood may be challenging for us. And there are four techniques, and we've talked about these before in other contexts in this webinar, but one is distraction, and distraction is a really great tool to deal with cues and triggers. We kind of just distract ourselves from it. And sometimes we can do that like with the breathing techniques, or we can do it by noticing or calling someone or doing anything to get our attention off what might be triggering for us in a troubling way. We learn how to self-soothe, how to, what is addiction except looking to some external source to comfort me. And this self-soothing skill is really important to learn how to kind of calm ourselves down, to walk ourselves back off the ledge and kind of, and settle ourselves. And that's a really tremendously important skill that I think most of us don't inherently have. At least a lot of addicts, myself included, didn't have until I started to kind of really practice that. We learn how to really accept the moment and improve the moment. And finally, we think about pros and cons, a little bit of cognitive stuff here. Okay, what are the pros and cons of not tolerating distress? We analyze the distress. What's going on here? What can I do to make it better? What might happen if I don't? So that self-soothing piece is really important. There's two more. The third one is interpersonal effectiveness. How do I basically improve my ability to express myself, to manage myself in my interactions with other people, which is often a really troubled area for a lot of addicts. And so one of the ways, is learning how to speak assertively, right? Not aggressively, not passive aggressively, but starting to really assert our needs. And I know from working with our clients in group, but I know from working with other addicts that oftentimes people don't really know what their needs are. We have to really kind of think about that. We have our clients every morning and check in, go through a list of emotional needs. What needs do they want to be met today? And I think a lot of addicts just kind of soothe themselves automatically without really figuring out what is it that we want? What is it that we actually need? So assertive, keeping that relationship healthy and positive, and keeping it clean, if you will, in terms of just up to date on what we say and not having a lot of unspoken baggage kind of weighing down the relationship itself. And then finally, in terms of communication, equally important to how we speak assertively is listening. How do we listen? Just really being quiet, hearing someone, being an attentive listener, being empathetic, listening and witnessing and receiving without feeling we have to solve the problem or offer advice or fix. And so those kind of skills are just really, and some of these sound like common sense human skills, but that's why it's so important to kind of nail these down and really practice them. A lot of DBT has little breakouts of little things to do with acronyms to help you remember. And I want to just give an example of this from this third one, interpersonal effectiveness. There's an exercise called GIVE, where GIVE each stand for something. So G in this case stands for gentle. Remember this about interpersonal communication. Gentle, don't attack, don't threaten, don't judge, right? There's a certain element of kindness that I think we see people starting to emphasize in our post-COVID communication. The I would be interest, showing interest with good listening skills. So we don't interrupt, we don't offer advice, we're interested, we lean in, we nod our head, we're engaged, we're connected to that person. The V would be validate, validate that person's thoughts and feelings. I can see how you would feel that way. Gosh, I can understand that makes sense to me that you would be having this reaction. Whatever it is that we need to affirm that other person. And finally, the E, try to have an easy attitude, right? To smile, to stay lighthearted, to be engaged and light without reacting, without imposing some kind of reaction on the other person. And then finally, and I'm talking a lot tonight, but finally, the fourth one is emotional regulation. And that's our ability to control our emotions. And we know that a lot of addicts have a lot of trouble with this. There's mood swings, right? Up, down, angry, happy, sad, hurt, kind of all bouncing around all over the place. So that the ability to regulate ourselves and regulate our emotions is really important. And this really helps people navigate powerful feelings. And one of the things that we teach our clients to do this too is to really identify them. Let's name those feelings. What is it that you're feeling? And then to be able to express it and reduce the goal in this, ultimately the unspoken goal, I guess, is to really reduce emotional vulnerability so that I'm not as vulnerable to the whims of my mood, to other people. I can kind of react. I can hear bad news. I can hear good news. I can be excited. I can be sad. but I'm not going to lose control of my feelings. I am able to kind of self-regulate. So all these are really incredibly important skills. And I think we do a lot of it informally. We don't call it DBT when we're teaching a lot of this, but I think it's helpful to name it, Dialectical Behavioral Therapy, and to kind of summarize what these 4 skills are, and to remind people that they're really, really useful set of skills for our recovery. So I think that's it. Thank you, Scott.
Thanks, David. I don't think we've talked about DBT in quite this way, or at least it didn't stick with me if we did, which is entirely possible. Type your questions into the Q&A, but I just kind of want to review some of the things you said in comparison with addiction. Addiction is a coping mechanism. It's a maladaptive coping mechanism. It's how I cope with my feelings. Because I don't handle my feelings well, and I don't handle other people well, and I don't handle the world well. So I go to something I know what I'm going to get, like alcohol or drugs or porn, or swipe left, swipe right for 6 hours straight.
Right.
I know what that's going to do for me. It's reliable. It gets me out of my head. And DBT is kind of the opposite of that. It's a different set of coping skills. Mindfulness, being in the moment. The one thing addicts don't want to be is in the moment. So the first skill you teach them is mindfulness, to keep them in the moment. Addicts don't tolerate distress very well. We have a feeling and we try to squash it immediately with alcohol or drugs. We don't want to feel. Addictions are not about feeling good. They're about feeling nothing. We really want to zone out. That's what addicts do. So learning distress tolerance, like healthy techniques, so we can actually sit with that. That's the second DBT skill. The third one is interpersonal effectiveness. Is anybody on earth less interpersonally effective than an active addict? Our whole thing as active addicts is, I don't want to reach out to other people because other people might hurt me. I'm afraid of you, frankly. So I won't reach out to you to get my needs met. And, the third skill that we teach addicts with DBT is learning how to reach out. And by the way, just a plug for 12-step programs, step 4 through 9 are interpersonal effectiveness. The first 3 steps, tell me I have a problem and I need help and I'd better get some help. Steps 4 through 9, prepare me, clean me up with the world. Step 10 keeps me there, and then 11 and 12 keep me sober. So working the 12 steps, you will actually get all of this that you get from DBT, just not as fast and differently. And then the last one, emotional regulation, isn't that what addicts do? We regulate our emotions with alcohol or drugs or sex or porn or whatever. So learning to regulate our emotions by reaching out to others and being mindful and breathing and all the things that David talked about, it just makes perfect sense that DBT works so well with addiction. So I wanted to ask you, David, first of all, if you want to add anything to that, feel free, but I wanted to ask, and I know I ask this every time, what's the difference between DBT and CBT, and should we rely on one or the other or both?
I think I would say both. CBT is, of course, kind of the classic standard therapy, cognitive behavioral therapy that's really based on a formulation of, the relationship between thoughts and feelings and the emotions that result from our thoughts and what we make of events, right? How we interpret things, and really helping us understand that our feelings are the result of this kind of formula of things. If we can go back and change some of the formula, specifically how we think about things, then we can affect the resulting feeling. In many ways, this goes a little bit deeper on that and can really, I think, in my mind, cognitive behavioral therapy sometimes can be maybe a little more abstract sometimes and kind of be useful for in a therapeutic setting, looking at these exchanges, but I don't see it quite as skill-based as this is. I mean, these are really practical, tool-built kind of things. CBT, you can do that as well. I just think these are so more universally applicable and easily grasped and utilized by anybody without too much practice and skill. You know, the other thing we find with, I'm cautious about CBT early on in recovery because sometimes, especially amphetamine users, their thinking can be a little bit muddled at first. And so CBT can be challenging and actually frustrating for people because they're in early recovery because they're kind of trying to manage and their brains aren't quite working at full speed, and it's very frustrating for everybody. So I almost gravitate toward these early on as really kind of skills to practice and really build for just the reasons you mentioned. It's like kind of the opposite of the addiction as a coping mechanism. Addiction is all about kind of escaping, avoiding, moving at that fantasy realm and disconnecting. And these DBT is all about leaning in and being present and engaging in the world in a healthier way. And so I think there's a role for both, frankly.
Yeah, and you know, it's funny, you mentioned this was initially developed, Linehan for borderlines. Every time we talk about DBT, I'm thinking, why would you develop this for borderlines? Why wouldn't you just go straight to the addicts? Because it's just such a perfect fit. But what is borderline, by the way? I don't know that everybody knows what a borderline personality is.
Right. So there are personality disorders or symptoms of different kinds of personality, what we call personality disorders, or used to call personality disorders, where they are names that can sometimes be scary to people, like antisocial or sociopath, narcissist, borderline. These are all kind of ways that are, they're complex in their origins. They're not necessarily only learned. They're sort of other relationships. They're often due to family dynamics at an early age, but they're considered pretty ingrained by the time somebody deals with them. And so, for example, before Linehan, actually, borderlines were considered a really, really difficult population to work with and pretty, with a very low rate of success and a lot of frustration. And DBT has kind of proved miraculous in terms of reaching people, giving them skills, and helping them really regulate. And so, of the personality disorders, what we often see with sex addiction are narcissists. That's the kind, or narcissistic tendencies, or what we call cluster B, which is how the DSM organizes certain of these characteristics. But they're personality styles and types that are sort of more deeply ingrained than just a behavioral thing. But yeah, so borderline classically 80% women, 20% men, just statistically. The classic way to describe borderlines in many cases is they crave the connection, but they also fear the connection. So this is like, come here, go away. Kind of like the anxious avoidance attachment style, very similar kind of dynamic.
Yeah, and then just let's throw a bone to the women here. Narcissism is mostly a men's disorder, isn't it?
Right. It's like 80/20. So yeah, it's kind of the flip side of that in a way.
Yeah, and both are untreated narcissism and untreated borderline are both really unpleasant to be around. They're just very hard people to be, like a true narcissist or a true borderline. It's hard to be around them. So yeah, they can pull it together a little bit, but it's going to come out eventually without some skills in place.
Right, and it can be very disruptive if in a residential setting, for example, too. So because it's a lot of drama, typically.
Yeah. So okay, we're going to go to the Q&A. So type some questions into the Q&A. We have one here. Is it a good idea to study DBT if you haven't mastered all those skills before you start intensely studying Buddhism? So should you do DBT before Buddhism? I feel like DBT might be easier to grasp than all of the Buddhism, but I could be wrong, LOL. Interesting question.
Yeah, you know, I hadn't really thought about this before. There's a lot of overlap between Buddhist principles and DBT. And I think I agree. I think for all its simplicity, Buddhism can be sort of complex to grasp sometimes, and I think DBT is very concrete. And so, yeah, I don't know, I think you could easily blend them. It depends on your personal style. I think they match pretty well. Some people might find a certain aspect of Buddhism or Buddhist practice useful and more relatable. And so I don't think there's any right or wrong in terms of how you approach it or how you start it. So I think it's an interesting question. I hadn't really thought about that before, but I think there's a lot of overlap, and especially in terms of being present and the non-judgmental piece. But yeah, I think DBT, my having played around with both, I think DBT is probably a little bit easier to hang on to, and it's kind of more user-friendly because they're like those acronyms, the tools and things like that that are very kind of relatable. But I think they easily match. They don't contradict each other in any way. So I think whatever your personal preference is probably the way to go on that.
Why does Buddhism have such a strong appeal for people in recovery and people in a process of healing? And do you have any thoughts on that? I've seen so many people switch from one religion and end up at Buddhism or some form of Buddhism and be very happy there in recovery.
Yeah, I know I've had clients who Buddhism appealed to because of their own concern about organized religion, and I think kind of misinterpreting, frankly, the religiosity, of the 12 steps, and skipping over those, the God of your understanding kind of thing, and getting hung up on some preconceived notion. So I think sometimes Buddhism just seems more friendly and non-judgmental. I think so. Somehow there's it's a really nice way to focus and kind of go inward and connect. I just think there's a very simplistic, although it can be highly complex, but there's a simplistic kind of approach to living that is very useful, I think, for addiction, where we get a lot of drama, and I think somehow it's an easy focus. I'm not by any means an expert on Buddhism, but I've dabbled, I guess. And for me, what appealed to me about it was the kind of clarity and simplicity of it, and I could go inward without a lot of preconceived notions. And so that,
yeah, I always kind of feel like it's that introspective look, but the non-judgmental introspective look. There's a lot of mindfulness aspects to Buddhism, and there's a lot of mindfulness aspects to the 12 steps and self-examination, but very gentle and kind of cleaning up our messes and taking responsibility. But
right.
So anyway, off topic, but interesting nonetheless. Do you think psychedelics can be useful for help with addiction under the right environment?
Boy, this is such an interesting question. Yeah, I could go off on a whole history of the approach to drugs in our culture. And the last 20 or 30 years, we've had very little research on drugs that were considered, illicit, despite some obvious, I think, medical benefit. That's been reversed now in the last couple of years. We're seeing more and more research with ecstasy. We're seeing research with ketamine and psychedelics as well. And I think, yeah, there are some really promising research and some very legitimate research institutions that are looking, for example, at psychedelics and their role in resolving certain aspects of trauma and PTSD. What they all involve is a very structured protocol with a lot of safety built in and very specific guidance and work and therapy. It's not just, these drugs are not just administered, they're always administered in conjunction with some kind of talk therapy that go with it, that kind of guide the person through. So I think in the next 5 years, I'm really actually quite excited. I think we're going to see a lot of breakthroughs actually in terms of some of these other chemicals that have been around for a while and kind of disregarded or nullified. And I think under the right circumstances, they're really powerful. So I'm excited about what we might see in that regard.
I'm more cautious than David's answer. I'm a lot more cautious than David's answer. And I actually think you are too, to a certain extent, but I've seen a couple people in various drug trials, whether they were psychedelics or, ketamine and even in controlled conditions, my observation, not as a researcher, just as somebody who knows these people and watched them in their day-to-day life, was it was far more harmful than useful. So I would always approach this with caution. But Bill Wilson, who founded AA, he did LSD trials in the 60s. Said it didn't do him any good, but he did it. A lot of people did, and there is experimenting now, and there are also, we've talked on this webinar in previous versions about coupling certain drugs with antidepressants or using certain drugs to reduce cravings. These aren't necessarily psychedelics, but they seem to work.
Yeah, I'm not sure if you're talking about like naltrexone or some other. Yeah,
some of those. Yeah, some of the other ones that are now coupling with naltrexone to
right.
even more.
Right, and again, it's sort of exciting research. Like for methamphetamine now, the New England Journal of Medicine a couple months ago came out with a trial that showed promising research. It wasn't a huge benefit, but it was a significant benefit for methamphetamine cravings by combining Wellbutrin and naltrexone. Naltrexone, of course, being mostly well known for cravings and for opioids and alcohol. So I think we're starting to kind of open up and see. However, I think the tendency is, I think an addict is always looking for something external to solve the problem. And I think that's, even if we have something external that might help, I think it always goes, as I mentioned, always with therapy, there's always a lot of support. I think there's other activities that kind of make it work. So that's a really important thing to mention. I think it's not just the drug in isolation. And I also want to mention there's a lot of notoriety right now about some other drugs that are illegal in the United States, like ibogaine or ayahuasca, that are being touted as, curing methamphetamine or curing PTSD. There's a lot of risk there. I know from a client of mine who went to Costa Rica for ayahuasca and had a terrible time and was unsupervised. He stole a Jeep. He jumped out of a 40-mile-an-hour Jeep, hit his head, had a traumatic brain injury, like horrible. So
there's the caution I was looking for.
There's the caution, yeah. So,
and there are people in recovery who go to, I know a couple of people who go to Burning Man every year and stay sober, except they do peyote or some other, mind-altering substance to have a spiritual journey. And I try not to judge, but I can't help but judge that one. I'm sorry.
That's not my recovery. I must just.
Yeah, it's not how I do things, but yeah. So, I can have a spiritual journey without peyote. Not all areas of the country have certified sex addiction therapists. Also, ongoing therapy is expensive. Can a sex addict get into and stay in good recovery just in 12 steps alone without therapy? If so, how? Thoughts on Sex Addicts Anonymous versus Sex and Porn Addicts Anonymous? I'll probably let David answer this, and then I'll give it a go too.
Yeah, thanks, Scott. Yeah, you're right. I was trying to find a CSAT once for a client going back to North Dakota. I'm not a single one in the state. So there's a lot of areas that don't have CSATs. Can you get sober without a CSAT or even without therapy? Yeah, I'm not saying you can't, but I would say that it's greatly beneficial just simply because it's going to save you a lot of time and I mean, years of time, probably, if you're kind of doing this trial and error and working your way through. And remember, 12-step program is not therapy. It's two very different functions. And so while the steps are incredibly powerful and useful, they're not therapy, and they don't address, for example, trauma and some of the traumatic reactions we see. And so I do worry about not having some kind of therapeutic element on board. So I think, I would just underline that 12-step is not therapy. And so can you get sober with just 12-step? You probably can. I just think it's going to be a lot harder, a lot more difficult without that guidance. I'm going to let Scott speak to SAA versus SPA. I just think SPA is not nearly as common, maybe except in the LA.
New program.
Yeah.
So, yeah, you're right. Not all areas of the country have a Csat. There are Csats who also do coaching online, which they use to get around licensing requirements. Like, David can only practice in Florida and California where he's licensed. So he couldn't take somebody from Wyoming unless he was coaching. So there are Csats around the country who do that. You can email us, email Tammy, Tami, at seekingintegrity.com. She can direct you to people who will do that. And there are also plenty of therapists in Canada who can do straight up therapy online with people in the US because they're not as, their licensing laws are just not as restrictive. Yes, ongoing therapy is expensive. Sex addiction is expensive too, just point that out, particularly when you start to have consequences. And in terms of just 12-step recovery, and I think David will validate this, there's a fair amount of research. It's hard to define success in addiction treatment, but no matter how a particular study chooses to define success, the treatment outcomes are better when it's 12-step therapy mixed with individual therapy, mixed with group therapy, mixed with other forms of support. The more types of support you have, the better off you're going to be. I mean, you can go to three 12-step meetings a day, but you're better off going to one a day plus, a therapy plus a different support group plus, finding a religious community that works for you. The outcome just tends to be better. I think the more ideas you get, the better off you're going to be. I'll do a plug for some of the things we offer through Sex and Relationship Healing and Seeking Integrity. I mean, you've obviously found free webinars and we also have free drop-in discussion groups. I don't know if you're male or female, but we have drop-in groups for men. We have drop-in groups for women. And they're really great. Usually, group therapy is less expensive than individual therapy per session. Also with addicts, it can be more effective.
Yeah, I just want to throw that in. That's a really important point because ideally, and I know this gets expensive fast, but ideally, the best scenario in my mind would be a 12-step program combined with individual therapy, combined with a group therapy. And I say that because group and individual work in two very different ways. Individually, you can do a lot of the more personal trauma, depth work, and the group process is really the central healing feature. I even say that about, despite the fabulous therapists we have with Seeking Integrity, the group is really a tremendously powerful healing modality, just the group itself. And so I think that group process and 12-step, 12-step meetings are not group. So group allows feedback, group allows crosstalk, group allows, it's facilitated. It just really is an opportunity to continue the growth experience that you might have from a springboard in treatment if you're lucky enough to go treatment. So both are, and I understand it's expensive, but both are really important.
Yeah, and yeah, if you can afford inpatient treatment, a couple of weeks of inpatient treatment, like at our LA facility, it's a great way to jumpstart the process, but that is expensive, and we don't hide that fact. We also,
as a sex addiction, I mean, your point is really.
Yeah, I mean, how much have you thrown out on your addiction?
Right.
My expenses and legal fees and this, they added up to way more than my treatment ever did. But that's a whole different story, and we don't have enough time for that one today. The other thing I'll throw out is through Seeking Integrity, we also have some low-cost online options. We have online work groups. David for chemsex addicts, substance sex parent addictions. He does, is it 4 weeks or 6 weeks?
It's a 4-week, 90-minute groups, really intensive, small. If people are interested in learning more about chemsex, it's a very personalized education group.
And you usually have like 4 or 5 guys in there. So
we have 5 this last cycle.
Really personal.
We don't have one scheduled yet, but they were all guys who were struggling with chemsex, who wanted that kind of personal interaction information in deciding to go to treatment or not or whatever. But it was a nice opportunity to kind of learn more.
Yeah, and then on top of that, we have a level 1, a level 2, and a level 3 work group for straight up sex addicts or sex and porn addicts. And that's really inexpensive, I think, and they're 6 weeks. And we have most of the guys who start out in level 1 end up going through all the way through level 2, because it's about a little over $1,000 to do all 3 courses. And then people have been badgering us about what can we do after the 3 courses, because they like the online format. And I just had a long meeting with Tammy and Stuart Leviton, our COO, today, and we're going to start offering like 6-week support groups facilitated by one of us. So that those groups can stay together, but you'll have to be alums of either the treatment center or the work groups, David's work group, or the ones that Jason and I teach. So lots of options. The more options, the better. Info on group therapy after Seeking Integrity. This is from somebody who is, I think, still there this week, but graduating, I believe.
Right. So a lot of guys who go through the program actually sign up for the work groups afterwards. It's just kind of a way of, a lot of the material has been covered, but it's a second go around material, but it's the group experience and a new set of faces, and just it reinforces. And I think in addition to just the educational material, is that the power of that group, the connection is really important. And these guys bond just as if they would if they were sitting in a room together. It's all on Zoom. So the other thing is that a lot of therapists will run groups themselves. As I mentioned before, I'm a strong believer in that, with a group therapy run by a Csat or some therapist, where you can really start to pursue some of these. Actually, a lot of the stuff we talked about with in DBT, right? The communication skills, for example. How do we listen? How do we communicate? How do we regulate ourselves in a group where we're uncomfortable, or we just got confronted about something? I mean, all these, it's a great way to practice skills in a safe and guided way. So yeah, I think there are groups out there for sure.
Yeah, and this kind of brings up a thought for me, and I'd like you to just maybe talk about it a little bit, David. There is no cure for addiction. You don't go to 2 weeks or 4 weeks or 20 weeks of intensive treatment and walk out the door and you're fixed. As a matter of fact, we tell people, when you come to treatment with us, we're going to break through your denial. We're going to give you a foundation of recovery. We're going to give you a plan for when you leave recovery. Basically, we're going to prep you for the lifetime of work that is ahead of you. So thoughts, David?
Yeah, I mean, that's absolutely true. If you look at the steps, step 1 is about giving up the substance or the behavior, right? And that's just the beginning. And after that, the fun starts, right? The healing and the recovery. But it's a lifelong commitment that we just don't take the chance. I've been sober many years. It's so far from my existence, I don't think about it, but I'm certainly not going to take a chance on seeing what it'll be like now. It's a lifelong commitment. And frankly, that holds no appeal. And this is the benefit of, if you can say, in recovery long enough, I think eventually the recovery is so appealing, and the life you have and the way you live is so much more beneficial than the struggles and the pain and the conflict and the disappointment and the remorse and the shame, of active addiction. It's just that doesn't hold any appeal to me. And the potentially seductive, I guess, escape numbing agent of drugs or behavior also doesn't appeal, because I know that's really a dead end. So, but definitely, it's a lifelong.
Yeah, it's like heart disease or diabetes. It doesn't have to rule your life, but you do have to make some effort pretty much every day to keep the disease in remission. And that's how I've always looked at my recoveries. It's like diabetes. You know, if I eat a bunch of sugar and don't take my insulin, I'm probably going to have problems with my diabetes. If I don't go to meetings and don't talk about my problems, and I'm probably going to have trouble with my addiction. And I skipped over the second half of the previous question. Thoughts on Sex Addicts Anonymous versus Sex and Porn Addicts Anonymous. There are a lot of S programs, we call them. There's Sex Addicts Anonymous, Sexual Compulsives Anonymous, Sexaholics Anonymous, Sexual Recovery Anonymous, Recovering Couples Anonymous, Porn Anonymous, Porn Addicts Anonymous, Sex and Porn Addicts Anonymous, and Sex and Love Addicts Anonymous. And those are the ones I can think of off the top of my head. The porn groups are all, if there's a P in the title, Pornaholics Anonymous or Porn Anonymous, Porn Addicts Anonymous, Sex and Porn Addicts Anonymous. It's a relatively new program. It's only been in the last couple of years where porn addicts find themselves going to meetings for sex addicts, like, for instance, Sex Addicts Anonymous or Sexual Compulsives Anonymous, and Sexaholics Anonymous. Those are the three biggest programs. And some of them, you know, particularly some of the younger guys in the 18 to 25 range, had never actually been sexual with another human being. Their entire sex life from 12 or younger onward involved porn and maybe webcams or sexting. They never actually touched another human being or been touched sexually by another human being. And they were struggling to identify as sex addicts. And particularly in a room where, you know, the guy next to you has had 1,000 different partners, which is not unusual, and not a lie or a brag. It's just what sex addicts do sometimes. You know, and they've had no partners. It's just, so these porn 12-step groups sprung up. And my advice on these, every group is kind of the same, but slightly different. Even within a program, like Sex Addicts Anonymous meetings in LA are slightly different than in Palm Springs and then in Phoenix, you know, same for porn meetings. But Sex Addicts Anonymous is very different than, say, Sexaholics Anonymous. Sexaholics Anonymous defines what sobriety looks like. Sex Addicts Anonymous, you define what sobriety looks like. Most of the sexual recovery programs, the addict defines what his or her recovery needs to look like. That's how we do it at Seeking Integrity as well. Sexaholics Anonymous, the only sex you're allowed to have is with your legally married partner. And it used to be your legally married heterosexual partner, but I think they've lightened up on that one. So it's a rough group for a single gay man to go to, whereas Sex Addicts Anonymous or Sexual Compulsives Anonymous or SPA might be a lot more accepting. So my take on it is check them all out. Anything that's available in your area, check it out, and see where you feel the most comfortable and the most supported. It's like, yeah, go ahead, David.
I was just going to ask, for guys that have both, so the chemsex people, right? Both the sex addiction and the drugs, what I have heard is that SLAA is a very friendly fellowship for that. There's a lot of crossover there. So is that your experience too, Scott?
SAA, SCA, and SLAA have lots and lots of crossover with alcohol and drugs, for sure. SCA is actually the most gay-friendly of the program, generally speaking. It was founded, I think, in San Francisco by a bunch of gay guys who were sort of rebelling against SA, which wasn't very friendly for gay guys. SAA, I think, started on the East Coast. It's basically the same program, and they've both filtered all over the country. In my experience, at least half the guys in any sexual recovery meeting, and women, by the way, will also be in recovery for alcohol and drugs, or one or the other, or both. most people get sober from alcohol or drugs and then realize they have a problem with sex addiction or porn addiction or love addiction. And then they get in. I did it backwards. I got into sexual recovery first and then realized that alcohol and drugs were a problem. And SLAA, Sex and Love Addicts Anonymous, is the one that women tend to feel the most comfortable in. But again, check them out, see what works for you. David, do you recommend with chemsex addicts a combination of groups, by the way?
Yeah, I do. Ideally, in my mind, kind of two fellowships, AA, NA, or CMA sometimes, kind of the drug-focused, and an S group to combine the two. I think unless you can find a meeting like an SCA or an SLAA where you're really comfortable in both, I think that's fine. But where I kind of issue a warning is in having too many sponsors, right? I think just like having too many therapists, you can start to, there's the potential for playing off each other and triangulating and getting mixed messages if nothing else. And so I think kind of one senior sponsor at least is useful. But at least the way the meetings are structured here on the East Coast where I am, people tend to be more comfortable in a couple different fellowships, usually NA, sometimes CMA, although CMA is spotty in terms of the recovery around the country. NA and then one of the S groups.
Yeah, and you know, it used to be you'd go to an AA meeting, and if you talked about anything other than alcohol, the old timers would scream at you. That doesn't happen very much anymore. I'm very open in my AA fellowship about all of my problems, and nobody, it's been 15 years since somebody sniped at me for doing that. So you should feel comfortable in pretty much any program. Everybody's there for the same reason. We're all struggling with a behavior of some sort. So yeah.
I do want to put in a plug since it's quiet tonight. For my In the Rooms group on Tuesday nights, I do a chemsex support group, and it's not necessarily a 12-step group at all, in that it's a moderated group, something like this. And I give feedback. People do crosstalk. It's a web-based group, but I think it's what people say there is that they feel that there's kind of a safe place where they can explicitly talk about the connection between the sex and the drugs without kind of feeling they have to fit their share to the parameter of whatever fellowship there might be. So it's kind of an open-ended group where we do talk about the direct link between sex and drugs. And very explicit.
Yeah, and that's on intherooms.com on Tuesday night. And David is one of the few people who would even remotely qualify as an expert on this fusion of sex and drugs. I mean, he's literally written the book on it and is almost done writing the expanded book on it. And nobody else is really writing about it or thinking or treating it very well.
Well, and this is, if I can do a personal gripe, I think a lot of people claim to have expertise in it, they don't.
Yes.
And so we get a lot of clients that seek integrity. I get a lot of my own practice that have really been harmed by people that thought they could do it all, and they don't have the training, and they end up ultimately hurting the client.
Yes. David's for real. Just
real deal.
I'm going to be really clear about that. David's the real deal. Okay, next question. If my spouse doesn't really get along with my therapist, actually not at all, I'm beginning to wonder if we could benefit from getting another therapist. I've been seeing this therapist for a year and a half and have completed disclosure. Is this a good idea? So it sounds like a couple, the betrayed partner has been seeing a Csat that the cheating partner, I think, doesn't like, but maybe I have that backwards. It might be the cheating partner's seeing a Csat that the spouse doesn't like. But either way, if your spouse hates your therapist, do you need a new therapist?
Yeah, that's a problematic situation, right? If you need a baseline of good communication and skills back and forth. Now, it's certainly not a requirement of therapy that you like your therapist. I mean, sometimes therapists have to say stuff that makes people not like them, you know, because often in my mind, the therapist is charged with kind of speaking the truth as they see it. And if all my clients never feel upset with me, then I'm probably not doing my job. So we have to challenge people. However, you also need a successful relationship where people can kind of listen and respect each other. And so 1.5 years is a long time. I think you said you've been going there. I think, I don't believe in kind of just switching therapists on a casual basis. I think because this is an important relationship, and I think sometimes in every therapeutic relationship, you're going to bump up against challenges. And we spoke earlier tonight about how addicts kind of like to avoid and run, right? And so I think an addict thing to do would be to, as soon as there's conflict, to bail. So I think it's worth trying to go through those points and see what that's about. There might be a real opportunity for growth there. However, if it's just consistently a problem, then I think probably getting a new therapist might be a good idea, just to get your healing process going forward.
Yeah, and we got some clarification in the chat feature. This question was asked by the addict, and it's the betrayed partner who doesn't like the Csat. And this is actually not an unusual situation. Betrayed partners often can get adversarial with the addict's therapist for various reasons.
Right, and we mentioned before how this healing process can involve a lot of therapists, and so the ideal situation, from my point of view, is to have the addict have their therapist and the betrayed partner have their own therapist, and that's for a couple of reasons. One, it's important that each person feels they have an ally who's exclusively got their back, but also the whole phenomenon of betrayed partners is a real specialty. This is another area where I see partners really not served by therapists who have no training in the area, because there's real trauma, there's real distress, there's real pain in a way that I think people can minimize or not understand unless they have that training, the understanding of how partners are really seeking that emotional safety. So I think there's a good case.
I think they often will tell a betrayed partner what the betrayed partner wants to hear instead of the truth, or because they don't know,
Right.
particularly if it's not a Csat.
Right.
And I think that's when it gets adversarial with an actual Csat.
Right. And I think you said post-disclosure, but the disclosure process is a huge piece, and it's a very specialized protocol that most therapists don't have unless they've had this special training. So there's a lot of specialty involved here.
What questions should be asked at the first Csat appointment? I'm definitely going to ask if he offers DBT. That's a very good question.
Great question. Well, I assume you've already done that. You already see that there's a Csat certification there, which is important. I'd ask them what their approach is on dealing with trauma, some of the underlying issues that go with that, what their approach is on recovery, on dealing with partners, on disclosures, how that whole process goes, how someone can expect it to unfold, to ask them about their approach in general. I think sometimes there's a little bit of room here for different kinds of approaches, and I think, assuming there's a baseline level of training and that there's that credential, you can assume that. It often comes down to style and whether there's a fit and whether you like the therapist and you feel you can communicate with them and they can hear you and listen, and vice versa. So I think there's kind of an energetic connection that's hard to quantify or put in words sometimes, but I think it's more of a feeling. So I think I would just kind of check the chemistry. That's almost more important than anything else in my opinion.
Questions are flying in now. The world is opening up. Do you think there will be a backlash on recovery for people as they re-enter the new world?
Backlash on recovery meaning?
As the world is opening up, restaurants and bars and things like that, how's that going to impact recovery?
Oh, well, I think we've been very controlled, although I must say during
when everything shut down, there was a ton of relapse.
Yeah, I was going to say for sex addicts, especially porn addicts, it's been a terrible time because people are stuck at home, they're stuck on their computers. A lot of people have been discovered that could pull it off if they were traveling or somewhere else. There's been a lot of struggle with the being at home. So I think in many ways it's going to be kind of a relief for people. But yeah, addicts are opportunists, and especially sex addicts. So when when the world opens up, there's going to be more opportunities to kind of get in trouble. And I think there's a built up kind of longing to kind of get out there and connect. And so, yeah, I think we'll see some struggles. However, I think also, along with that same opening up, are meetings opening up. I think in-person meetings are probably more effective overall. And I think the ability to connect and build a support group will be opened up as well. So I think it's kind of, it goes both ways. But I think, yeah, there's going to be a struggle, although the pandemic was a terrible struggle for addicts as well. Not only for sex addicts, by the way, for drug addicts, overdoses have tripled, and just it's been a nightmare for a lot of addicts this past year.
I'm going to try and squeeze one more in here. I understand that each sex addict creates his or her own three-circle plan, but I also understand that continuing certain behaviors continues the dopamine hit. My sex addict stopped looking at porn and masturbating, but still looks at pictures and profiles of women. He apparently gets a hit from his fantasies when he looks. He says it's not breaking his sobriety because it's not in his inner circle, but it seems he's still going for the dopamine hit from the behavior. He told me he doesn't want to give it up, that it's all he has left. Now he's backtracking and saying he doesn't want these lustful feelings and hopes over time that the feelings won't be so strong. What I know is the behavior is still hurtful and threatening to me since he started there and crossed boundaries physically with a number of women. Thoughts?
Yeah, I mean, I agree with the writer here that that may not be considered acting out traditionally, but what we know is that that kind of fantasizing and thinking, and even something like Instagram or Facebook, where there's a lot of triggering images, which seems innocent enough, but yeah, you absolutely bet they're getting a dopamine hit from that. And I think, you do that long enough and it escalates. And I just think it's a bad idea. We were having this talk earlier today with some guys on the unit. That's a bad idea because you're still playing with it. It's just a matter of degree. And eventually, if you do that long enough, it's going to build. So I think it's a really bad idea. It's like being on the apps, on the hookup apps. If you don't intend to hook up randomly, the apps probably aren't a good place for you to be.
Yeah, and the simple truth is it's hurtful and threatening to you. And if I'm the addict and I want to save my relationship, I need to listen to my partner when my partner is saying, it feels like cheating to me, even if it doesn't to you. I had a sponsee, really gregarious guy, and he had a real tendency to flirt with waitresses. And his wife would get mad and he would say, I'm just being nice. Now, I was out to dinner with him once and we had a waiter and he didn't flirt. And I pointed that out. And he's like, oh my God. And then I pointed out that either way, it's hurtful and threatening to your wife. And maybe you should start looking at things through her lens because you betrayed her. You're the one who sort of put her in this situation where she feels this pain. If you hadn't cheated, this wouldn't be a big deal, but you cheated. I can get real pushy with guys I'm sponsoring and working with about stuff like this. I'm with David. Yeah, sex addiction is a fantasy-based addiction. And even if it's not in the inner circle, we can be indulging. Yeah. I mean, this is not like alcohol. If I take a sip of beer, I have broken my sobriety and I need to start my count over. Sex addiction allows me to define it in ways that work for me, but I have to be really honest about what my addiction is. And it sounds like maybe he needs to revisit his three-circle plan with his therapist and sponsor. So, okay, we're out of time. We have one more question. You want to take it real quick, David?
Sure.
Okay, I find it really hard to be empathetic when I try to show my wife empathy, it feels forced and comes across as fake. Are there any resources that focus on empathy?
Gosh, really quickly, I'd look at some Brene Brown stuff online and see what she says and what she does. And yeah, empathy is a really vital thing to establish. And so that's something to really work on.
Yeah, and go on our sex and relationship healing site and in the search feature, type in empathy, because we've got a couple of pieces written about empathy that might be helpful as well. So thank you, everybody. Questions came in fast and furious once they came in.
Yeah.
So we'll be back next week. We'll see you all then. Thank you for sticking with us. Have a great week. David, have a great week. Send me your PowerPoint.
I sure will.
We'll talk later.
All right.
Night, everyone.
Bye-bye.